Yeah, we don't want to do anything to scare you.
We are here to discuss a topic that holds significant importance in our daily lives: wound care first aid. Accidents and injuries are inevitable, and being equipped with the knowledge of proper wound care can make a crucial difference in the healing process. First aid for wounds involves more than just applying a bandage. It requires a basic understanding of how to clean, protect, and promote healing for various types of injuries. Whether it's a minor cut, a scrape, or a more serious wound, the initial steps we take can greatly impact the overall recovery. Here are the basic steps for wound care of different types. Bruise. A bruise, also known as a contusion, is a type of wound that occurs when small blood vessels, known as capillaries, break near the surface of the skin, causing blood to leak into the surrounding tissues. This typically happens due to some form of trauma or injury, such as a bump, blow, or impact. Bruises, often present as discolored areas on the skin, ranging from red or purple in the early stages to yellow or green as they heal. The discoloration is a result of the body's natural response to the broken blood vessels, and it is caused by the breakdown of hemoglobin in the blood. Applying a cold compress to a bruise can help reduce swelling and lessen the pain. Here's a simple step-by-step guide on how to do it. First, you need to gather supplies. You'll need a cold compress or ice pack. You can use a reusable gel pack or even ice cubes in a plastic bag. Then, wrap the cold compress. If you're using a gel pack or a bag of ice, wrap it in a thin cloth or towel. This step is crucial to prevent direct contact between the ice and the skin, which could lead to frostbite or ice burn. Then, place on the bruise. Gently place the wrapped cold compress on the bruised area. Hold it in place with light pressure, but avoid pressing too hard, as this could cause further damage to the injured tissue. Keep the cold compress in place for about 15 to 20 minutes. This duration is generally effective in reducing swelling without risking damage to the skin. Then, take breaks. After 20 minutes, remove the cold compress and allow the skin to warm up for at least 10 to 15 minutes before reapplying. This helps prevent overcooling and potential harm to the skin. Lastly, repeat as needed. You can repeat the cold compress application several times a day during the first 24 to 48 hours after the injury. This initial period is when swelling is most likely to occur. As you do these steps, you must monitor for sensation. Be attentive to how the skin feels during the cold compress application. If the patient noticed excessive numbness or discomfort, remove the compress immediately. Burn. A burn wound is an injury to the skin or tissues caused by exposure to heat, chemicals, electricity, or radiation. Burns vary in severity, ranging from superficial burns affecting only the outer layer of the skin to deeper partial thickness or full thickness burns. Treatment for first-degree burn involves first aid, including cooling the burn with cool water. Here's a simple step-by-step guide on how to do it. Prepare a clean towel and a room temperature, running clean water. Place the burned area of the skin in a running water for 15 to 20 minutes. Dry the skin with clean towel. Do not scrub the skin to prevent skin from tearing. Abrasion. An abrasion is a superficial skin injury caused by friction or rubbing against a rough surface. It involves the removal or damage of the top layer of skin cells, resulting in a scraped appearance. First aid involves cleaning the wound, applying antiseptic, and covering it. Here's a simple step-by-step guide on how to do it. First, gather all the materials needed. It may require tweezers, clean towel, antibacterial ointment, and bandage. Assess the victim for pain. Then, if debris found in the wound, carefully remove them with tweezers. Then, clean the wound with soap and water. Make sure the skin is completely dry to prevent infection. After that, gently put antibacterial ointment in the wound. Lastly, place a bandage to cover the wound. Puncture. A puncture wound is an injury caused by a sharp object penetrating the skin, resulting in a narrow and often deep wound. These injuries can vary in depth, may not cause significant external bleeding, and pose an increased risk of infection due to the potential trapping of bacteria. Puncture wounds may damage internal structures, and first aid involves cleaning the wound. Here's a simple step-by-step guide on how to do it. First, gather all the material needed. It may require gauze or clean towels, antibacterial ointment, and bandage. First, if bleeding, apply pressure with a gauze or clean towel to the wound to stop the bleeding. Once the bleeding stopped, clean the wound with clean water. Then, dry the wound with clean towel. Then apply antibacterial ointment to the wound. Lastly, place a bandage covering the wound to prevent infection. Laceration. A laceration wound is a type of injury characterized by a tear or cut in the skin caused by a sharp object. In some cases, laceration wound won't require stitching, therefore, basic first aiding will be implemented. Here's a simple step-by-step guide on how to do it. First, gather all the materials needed. It may require gauzes, soap and clean water, clean towels, antibacterial ointment, and bandage. Then, put a pressure to the wound by using a clean cloth or gauze to stop the bleeding. Once the bleeding stopped, wash the wound with water and soap. Then, path dry the wound with clean towel. Then, put antibacterial ointment with caution. Lastly, place a bandage in place to prevent infection. Stab wound. A stab wound is an injury caused by a sharp, pointed object penetrating the skin and underlying tissues. This wound is critical. Urgently, bring the victim to the hospital or call ambulance immediately. While waiting for the medical assistance, you may perform first aid to prevent the object from moving. Here's a simple step-by-step guide on how to do it. First, gather all the materials needed. It may require clean towels, medical tape, and bandages. Then, make sure the stabbed object is not moving. Then, place a clean towel to support the object from moving. After that, carefully wrap the towel with bandage to secure the object from moving. Avulsion. An avulsion is an injury where a body structure or part is forcefully torn away from its normal position. This can involve skin, soft tissue, or even a portion of bone, often resulting from traumatic incidents. Avulsions have irregular and jagged edges, and their severity can vary. These injuries pose a risk of infection, and prompt medical attention is essential for cleaning, assessing, and treating the wound, which may involve surgical intervention for repair and reattachment of the torn tissues. Here's a simple step-by-step guide on how to do it. Gather all the materials needed. This may include saline water, cotton, gauze, bandage, splint, ice if necessary. Call for professional medical help immediately. Control bleeding. Place a clean towel under the infected area to reduce infection. The avulsion is accompanied by dirt or debris. Gently rinse the wound with saline water. Avoid using excessive force, as it may cause further damage. Cover the wound with a sterile dressing or clean cloth to protect it from contamination. Use a bandage or gauze to secure the dressing in place. Be gentle to avoid causing additional trauma. Immobilize the wounded part by using a splint and elevate the injured area to help reduce swelling. Amputation. An amputation wound results from the surgical removal or traumatic loss of a body part, often an extremity. Proper postoperative care and rehabilitation, including the use of prosthetics and physical therapy, are crucial for optimal recovery. Emotional support is also important for individuals adjusting to the physical and emotional challenges of limb loss. What are the causes of amputation of a limb or extremity? Diabetes, peripheral arterial disease, frostbite, congenital limb deficiency, gangrene, neuroma, infections, peripheral neuropathy, arthrosclerosis, trauma, neoplasms. Regular changing of dressing and cleaning may help amputated part heal fast. Here's a simple step-by-step guide on how to do it. Gather all the materials needed. This may include paper tape, scissors, clean washcloths to clean and dry your wound, adaptic dressing or other dressing product, abdominal dressing pad, gauze wraps, a basin for water and soap to clean your hands while changing the dressings. Use soap and water on a gauze pad or a clean cloth to wash the wound. Start at one end of the wound and clean it to the other end. Be sure to wash away any drainage or dried blood. Do not scrub the wound hard. Pat the wound gently with a dry gauze pad or a clean towel to dry it from one end to the other. Inspect the wound for redness, drainage, or swelling. Cover the wound with the dressing. Put on the adaptic dressing first. Then follow with a gauze pad or ABD pad. Wrap with the gauze or cling roll to hold the dressing in place. Put the dressing on lightly. Putting it on tightly can decrease blood flow to your wound and slow healing. Tape the end of the dressing to hold it in place. Be sure to tape onto the dressing and not onto the skin. Put the elastic bandage on around the stump.